Your pharmacy's next Eureka moment is only one conference away. Catalyst Connect is the pharmacy event of the year. Connect with your pharmacy. Leverage your Pioneer Rx software. Enjoy the sights and sounds of Nashville, Tennessee. Register for Catalyst Connect now and save big with early bird prices until March 31st. See you in Nashville.
What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Hey everyone, welcome back to Beyond the Scripts. I'm your host, Will Tuft with Pioneer RX, and today I have a couple guests joining us, kind of shaking it up a little bit. We have Terri Albarano, who is a pharmacist and a pharmacy consultant with RedSail Technologies, and Joey Chamberlain joining us from Cheek and Scott Pharmacy down in Florida as the CEO. Thank you guys for joining us.
Thanks.
Thank you, Will.
Joey, tell me a little bit about Cheek and Scott.
We're an independent pharmacy. We've been in North Central Florida for it's going on 59 years now. So we're well established in Live Oak was where we originally started, and then we branched out to Lake City, which is Columbia County in North Central Florida, and then also Hamilton County now over in Jasper. We also have a medical equipment division that started probably 20 years ago or so. And we serve, I don't know, probably 10 counties in North Central Florida with our medical equipment division. So we do quite a few deliveries well beyond those 3 counties that we exist in with our pharmacy. We also just opened up a clinic inside of our Live Oak location, so we're expanding beyond those 2 things as well. So we're excited about that.
Wow! So for anybody not in the Florida area, what's the kind of geographic spread on those locations?
So we're basically dead center of the state between Tallahassee and Jacksonville. I don't know. We're probably, I would say those 3 counties are maybe 100 miles, radius, maybe gotcha. 50 to 100 miles radius. But again, we service a much larger area than that, with our medical equipment. And so, yeah, we do quite a bit in this area.
Awesome. So Terri, you come to us from the RedSail Technologies brand, which is actually the parent company of Pioneer RX. So tell me a little bit about your role over at RedSail.
Sure. So I'm a pharmacy consultant, and really what I do at RedSail is support programs that help independent pharmacies increase revenue in various ways, and also bring patient savings to their pharmacies, as well as through these programs, increase patient traffic. So some of the programs we have supported in the past through Pioneer RX and our independent pharmacies is a shingles program where we did point of sale education to eligible patients for shingles vaccination. So to help bring awareness to the community around shingles vaccination, as well as it increased the shingles vaccine at the independent pharmacies, as well as some other vaccines and script volume from patients they might not have seen prescriptions before. So that was a successful program. And with that program, we were able to provide data through the Pioneer software system as to how vaccines were tracking through the previous year with the release of the program, how their staff was educating and how the educating may have resulted or may have not resulted in an uptick in vaccines, as well as we were able to make workflow improvements with the education based on the workflow designs within our pharmacies. And that's just one example of a program we rolled out. We also have copay assistance programs, copay savings programs for pharmacies. You can see those on our website, as well as a program we're going to talk about today with Joey around cash prescriptions and cash pricing.
Yeah. So if you are a Pioneer RX user, you've probably seen some of the new feature releases and things for what is kind of lumped together as the RedSail Advantage, which to me just kind of is the most logical thing that could come about of, having a great technology company in the pharmacy arena is how can you kind of leverage that market position to benefit all of those independent pharmacies, and all of those various programs have kind of been grouped under that umbrella. So this was definitely not going to be a podcast that is kind of a commercial for the RedSail services, but one of the things we try to talk about on this podcast is, where pharmacies are finding success, and a time when so many pharmacies are struggling. There's a lot of bad news on social media and on LinkedIn, seeing pharmacies that are struggling with low reimbursements. And it is so exciting to see RedSail Technologies coming through with some solutions to help ease that.
I think that brings up a great point, Will. I think RedSail helps elevate the voice of independent pharmacy by providing another platform for, thousands of independent pharmacies to group together and provide a voice through that single platform. So it's been interesting for me in my position and very satisfying to be able to help the independent community. That's where I started my career. I still service that pharmacy and spend a lot of time with that owner. He's one of my mentors. And it's just very important to me that we sustain independent pharmacy. They're one of the backbones of healthcare in our country.
Yeah. So in that line, it seems like you can look at certain kind of, key moments in pharmacy history where we've seen transitions where, moving away from paper billing, moving into immunizations, moving into Part D. And it definitely seems like in the past few years, another one of those evolutions has been, that push to find revenue streams outside of the touch of PBMs. And even more recently than that, it seems like those pressures are not limited to the pharmacist, but you're seeing patients look for those solutions too with, cash programs that are providing relief for uninsured or underinsured patients, but, not always advantageous to the pharmacy as a business. So, Joey, tell me a little bit about how you've seen kind of the cash model, come into focus at your pharmacies and where you think that kind of history comes from, I guess.
Well, we've always known that cash is king when it comes to any sort of business. Well, the reason is pretty simple. Insurance companies, you're relying on a third party to reimburse you for a service or a good. That's not always a great place to be, especially when PBMs have proven to be fairly bad actors in the industry. So we've been struggling to try to combat, lower reimbursements with doing other things. And in our area, like we're in a very rural part of North Central Florida. We're a necessity for many of these services because there's a shortage of healthcare providers in our area. So we've had to step into, COVID testing and point of care testing. We've had to step into a lot of different areas, and it's mostly cash business. But it's a much needed service that we've had to fill in those areas. So at least in our neck of the woods, as they say in this area, is it's a necessity for a lot of those things. So the cash model, as far as and I also think that insurance is becoming less and less affordable as we move forward. So many more people now are opting out, and that's scary. But it's, again, for them, it's a necessity because you just can't pay the premiums as they are laid out right now. So there's several situations that cause that. I think if you have a family and you need to add them to your insurance, even if you get insurance through your employer, a lot of times it's $1,000, $1,200 to add your spouse and kids to that policy. So it's not affordable by any stretch. So we do have many more patients who are paying cash for their medications. They expect it to be within a reasonable range. So we do see a lot more of that on that cash side, even in our pharmacy business. Many of the other services we provide are cash as well.
So one of the challenges that I see in that is you have this great pool of patients who are, in that cash kind of bucket. But now you have a whole new business model to arrange, because in the third party area, it doesn't really matter what your pricing is to some degree, because they're going to pay you what they pay you, generally based on AWP, and whatever you send them, pretty much they're going to pay you that contracted price. That there's not a whole lot of math that needs to be done to stay competitive on your end, because they're handling all of that. So I've actually been to pharmacies. I remember a pharmacy when I was part of the installation team where the pharmacist did not want to go to lunch every day because he had cash customers, and he was afraid that his cash customers were going to get inconsistent pricing if he wasn't standing behind the bench. So, obviously that's a very specific example, but I think that probably hits close to home for a lot of people watching this.
The pharmacist just pricing every cash price individually. And with that, there's no standardization across the patient himself sometimes, or between patients, as well as other staff members. If you don't have a policy around how you're pricing. So that's one thing. And it's very labor intensive to do it that way, right? You're thinking about every prescription you're touching. What am I going to charge? And trying to figure out if you're covering cost. Other folks set up price tables within their pharmacy software system, like Pioneer RX has the price tables that folks set up. Again, that's a very manual process that needs to be touched on a regular basis. And a lot of pharmacies don't update their price tables very often, and the information's outdated, and they could be losing money on prescriptions. There could be opportunities to save patients money and be competitive. And so the main gist of it is it's not a standardized process, and it can be very labor intensive depending how you manage it. And you truly don't know how competitive you are. And we see a lot of people, saying to be competitive, they're calling other pharmacies in their local market. They're comparing their prices to what GoodRx coupon offers. They look that up. Again, labor intensive.
Yeah, and you mentioned the pricing rules. I know Pioneer RX specifically, I'm very familiar with that software, obviously, has a lot of options there. You can build as many different pricing rules as you want to and use different schedules, and you can manually do a lot. The problem is anytime you're doing something manually, you're missing opportunities. So Joey, how did you guys start off with your cash pricing? What was your first solution, and what problems did you run into?
So our first solution was the pricing tables, like what you're talking about. We set those up, and it was way better than what we had done previously. We're talking over 5 years ago. Over 5 years ago, we used a service that helped price out everything, and there are plenty of those out there, but it was all over the map as far as how appropriate it was, so it was a lot of manual adjustment for cash pricing, and the problem with that is inconsistency. Labor intensive, all the issues that you laid out, Terry. So yeah, those were the same issues that we were having. And when you're talking about things like a cough suppressant, right, that's not covered on somebody's insurance, like that should be something we shouldn't have to sign somebody up for a program to get them a decent cash price on, and this program, the RedSail cash program, was a perfect solution for that, because you can just push it through the cash plan. It does its algorithm for competitive pricing, and it's actually a really good price for the patient too. And that was one of the things that we had been concerned about in the past, is they were just way out of line with what people could pay, and we had to come up with a competitive solution that was consistent. That we didn't really have to spend a lot of time, getting people signed up for. So this was just a great solution for that. Those little one-offs, or a brand new patient who you don't know if they have insurance or not, you can just run it through there. And if they present their insurance card, you can get it at the register. But many times they don't even balk at the price now, because it is priced competitively.
Yeah. Yeah, that's one of the struggles when you are doing your own pricing is, you can plug in a couple calculations. There is a great loyalty tool within Pioneer RX that allows you to kind of protect that UNC and have that patient opt in. But inevitably you say, oh yeah, we'll just do, cost plus whatever. And then that works for a transaction. And then you see the next drug and you're like, wow, well, that's not in line, or that's way too high. So inevitably those things surface pretty quick.
We were having to adjust our usual and customary, which as is not, and I know the pricing tables and how to adjust that. That usually you have to get on the phone with your pharmacy software company and adjust those with them. I could make those adjustments, but it still is a bear. We don't want to. I hated doing it every time, and it's like, can we just figure out something that works across the board so I don't have to go back in there and manually do this each time? So we'd have the and Pioneer is great because it'll bring it to your attention if something does pay out at usual and customary, you can go in and make those adjustments to your UNC, and then moving forward, they're good. But yeah, it's just too much effort to try to monitor that and make sure that you're doing it properly. So
yeah, and if you are on Pioneer RX, this is a great reminder. Make sure you're using those. There are some really great RX edits that can help make sure not only if you're getting like a low reimbursement, but if you're leaving money on the table, if you're, cash limiting yourself, there's some really great financial tools already in the system. Make sure you have those turned on. So,
negative remittances is another one to look at. I mean, that's about $7 a pop on your Humana Medicare plans, I believe, for some of the medications that aren't really a part of their formulary, they'll cash them out as like a discount, but then they'll charge you a $7 fee too for the
So we actually had a whole lot of calls recently, and actually made some feature releases to be able to see some of those ID fields that are coming over that may indicate when that's happening behind the scenes. So make sure you're checking those change logs. So Terri, tell me a little bit about about how this plan works, because if you're not familiar with the cash program or the cash management program, and you are struggling with your cash pricing, there are a few solutions out there. So I think most pharmacies are somewhat familiar with the idea of what this product is, but tell me a little bit about it, kind of the elevator pitch.
With this program, one of the new features that we're actually launching that I'm excited to talk about is we have customizable pricing options now to help meet your patient as well as your local needs. And what I mean by that is, each geography and even region, they have their local competitive market. So we take that into consideration for pharmacies, and we work together, meaning there's 4 pharmacy consultants like myself, and you're assigned one when you join the program. And we look at, the different price options and where your pharmacy wants to be, and, what's the optimal opportunity for you. And with that, you get lots of data about the program. Joey and I have looked at some of his data already. We make sure that the program is working for you and, that you're making money, because the last thing we want is a pharmacy not making money. So I think, that's a bonus of a program like this, is that there's data and someone's watching it and reviewing it with you. Because a lot of people, there's data available, but at the end of the day, you're taking care of your patients, you're running your business, you might not have time to look at or process that data. You have someone helping you. There's also different types of pricing models that are available to this program. There's a subscription-based, there's a transaction-based, to make it affordable and to make it make sense. And, we were talking about the other programs out there, much, much cheaper and affordable than the other programs, who again, and many times could have you below cost on a transaction. We also look at getting the pharmacies a $10 to $12 dispensing fee on generic prescriptions, and about a $6 dispensing fee on OTCs that they're manipulating behind the counter. Because we feel that, your time is valuable and you should be compensated for any repackaging or services that you might provide for those OTC medications.
Yeah.
Joey, anything you think I missed there? I mean, again, the pricing's dynamic. So we're updating that based on any market feedback that we're collecting, as well as feedback from our users on the program. Sometimes customers come back and say, hey, this price didn't look quite right. And, we go right to the folks on the RedSail team working on those algorithms, provide that information, and usually within the same day, we get information back like, hey, we updated that price, thank you, or hey, here's what's going on. And sometimes it's something at the customer level with maybe those backup pricing tables like you were talking about. And that's another service that we provide with this. We look at those price tables you have set up to see, are these working for you and your pharmacy as well? And do we need to update those? So lots of discussion around not just are we pricing your cash prescriptions right, but is that pricing model working for you and your patients through data, through real data?
Yeah, the only thing I'll say that we missed maybe right in the beginning was not having a backup, kind of a fail-safe pricing table in place, because occasionally what would happen is it would revert to our usual and customary, if it wasn't built into the algorithm. So then we were back to manual adjustment and, that sort of thing, because, it was pricing really high on the usual and customary. So we fixed that by having a kind of a fail-safe schedule that we were using. And so I would just, if anybody is going to sign up for this, make sure you have that backup as well. Whatever you're comfortable doing, we sort of set a dollar amount over cost that is what we went with. But you can do it, 20 different ways if you wanted to. So it's just making sure that if there's not an algorithm that's being applied, that you have that backup to make sure that you're not having to manually adjust, because that was the whole point to us, was not having to do those manual adjustments.
So one of the challenges that, I'm thinking back to my time in, as part of the installation team, helping pharmacies put those initial pricing rules in. And even if you're really, just really dedicated and focused and attentive to your pricing, you're going to set up a handful of rules. You're going to look at maybe brand drugs, generic drugs, maybe C2s are going to be at a higher tier. And maybe we're going to have our priority therapeutic classes at a lower tier. And you're going to set these calculations. The problem is, if you look at your prescription records within any one of those categories that you've created, your net profit is going to vary from drug to drug within even those segmented categories. So I think that's really a big part of the challenge, is that one equation's not going to work across very many drugs, really, even those focused categories that you set up. So Terri, how does the RedSail Advantage kind of address that on a per drug basis? Does it vary by NDC? How can you dive a little bit more into the nuts and bolts of how that works?
It does look at a lot of different things. It looks at, the cost, the average cost that our pharmacies are paying for the NDC or the drug class. It looks at the competitive market. So, what are the large chains charging, the good RXs? What are all of our independent pharmacies? What are your cash prices? So lots of different variables, and it's tracked over time so that we're monitoring, because your cost also changes over time. Just sure. Like, we were talking on the reimbursement side, the wholesalers don't keep your cost steady. So there's lots of fluctuations in the market that the algorithm is looking at and monitoring. And, there's a certain level of confidence that we have to have in that price before it's built into the algorithm and we kind of roll with it.
One of the things that I think can happen as well is, at the pharmacy level, you get used to using, this is the NDC because that's what's in the robot, or because that's what we've always done. And a lot of times, you may run into an area with a specific drug where you're not able to, maybe you get a bounce back price and you're like, this is too low, or this is not a price or a drug that I can feel like I'm this, can be competitive at. Because sometimes this is a great way to identify some inventory issues and ordering issues as well, where you really can't be competitive price-wise if you're not being super competitive purchase-wise, right?
Yeah, I mean, we are constantly looking at our primary wholesaler agreements and making sure that we're maximizing our purchasing through those. But we actually have a secondary wholesaler that we use, that we actually work out our contract through our primary with. And so they have some interesting ways where we can purchase in bulk at the beginning of the month. So like we might place a $5,000 to $10,000 generic drug order at the beginning of the month. They give us an additional 5% off of our invoice price, in addition to whatever rebates we would get on those medications. So yeah, if it's, stuff that you're burning through a lot of, then yeah, you can make those bulk purchases and save an additional 5 to 10% off of the invoice price on those. Plus there's short dates. There's lots of companies out there for short dates. We're doing a little bit less of that because our wholesaler agreement is very good on the generic side. So, but we are finding an additional 5% on our generics that we can purchase in bulk through that program. So
yeah, there's always that dance of, you want to shop, but you don't want to shop yourself out of a rebate. But
and we want to honor the commitments that we made to our primary wholesaler, but always looking for opportunities to shave off a few percentages here and there when those present themselves. So we're more than compliant with what we've got in place. But those are easy ways. And, there are lots of companies out there who will provide bulk discounts if you purchase in a large amount. So just look for those things out there.
Yeah. Any advice there? Because I'm imagining if I'm a multi-store owner and I'm really, employing MedSync at my pharmacy, I'm able to predict my usage and say, hey man, I'm just ordering these, on my daily orders. How should I rethink this? Do you think that most independent pharmacies are going to be able to reach out to their, manufacturer, to their wholesaler rep and say, hey, I heard Joey on this podcast saying you could save me some money?
Oh, well, there are lots of ways. So we use AAP as our, we're AAP members, and they actually have worked out deals with Cardinal. So we do the vast majority of our purchasing through Cardinal. Our rep through Cardinal is very good about she sends us a daily report. So we know, and it compares our previous month's purchases to our current month purchases in that report. So every day we know what our month to date purchases are, like on the day that so that order that comes in today is included in that amount. So that's very important when you're getting down to the last few days of the month and you want to make sure that like your GCR is at the right amount. So all I would recommend is look at 2 or 3 or 4 months of purchases. And then you're going to know, pretty well how much generic purchases you can shift, outside of that purchase agreement. So if you're, if you've got $5,000 to $10,000, you can work with, or let's say 10. Let's say you got $10,000 that you can work with. Maybe take 5,000 and see if you can't purchase at a 10% to 20% discount for that $5,000 that you would have spent through your wholesaler. That it won't affect your GCR, so you'll still maintain your 16% or whatever it is you need to hit. And then you should have a pretty consistent idea. And we've noticed with the new contracts here, at least in Florida, that a lot of the companies who were forcing you to use brand medications are now allowing you to use generics. So we jumped maybe 5% in our GCR from last year to this year. So we've got a lot more room to purchase outside of Cardinal.
Interesting.
Yeah, so there other people may be seeing the same thing, but now's a great time to look at it again, because you could be 20,000 over what you need to purchase to meet those GCR goals, and then you can play with that extra money to see where you can purchase most effectively.
Yeah, so that's one side, and I think the side that most people focus on with a healthy MedSync program is that inventory predictability, and a lot of times, inventory turns and just-in-time ordering, but that predictability allows you to do just the opposite when it's appropriate too. And, you don't need to put that same medication on the shelf 6 times that month and unbox it and all that. You're going to use it. It's cheap. Get it on the shelf and save some money.
You make a great point. If you're optimizing your synchronization program, and you've got most of the people who are filling at your pharmacy going through that, and you're scheduling it, you don't have to leave it on your shelf. You know when they're going to fill it for the month. You order it in immediately before they have to come and pick it up. And those are dollars that, instead of sitting on your shelf or sitting in your bank account, that you can make a bulk order with. So you can save money not just on your drug purchasing at that point. You can save money on buying your labels. If I go out and I purchase a year's worth of labels, I might save several $1,000s right there. So there's lots of things you can do with the cash flow that you're not having to eat up with drugs on your shelf through programs like synchronization. So that just helps in a lot of different ways. Your cash flow is a big issue in the pharmacy. So.
Yeah. So let's talk a little bit more about cash flow, because that's really what's important, especially now everyone's, in the middle of the Q1 of 2024 struggles. So with MedSync, there's definitely a percentage, or, it's harder to do MedSync until you get a certain percentage, and then everything changes and it gets easier. I think independent pharmacies that are looking at paying for another service or starting another service, to have their team, perform extra work, or, any change really, you're looking at where that's going to be beneficial. So have you found that with using a cash management program in your pharmacy, were you able to immediately see like a dollar change, or was the first change that you saw more of a change in workflow and time and confidence? Is there a certain kind of teetering point where if you have X number of transactions, you really start to ramp up the benefits?
It benefits you in both ways in the positive. So I'm gaining more time for my staff back. Plus I'm actually getting a capturing a little bit more revenue per claimant. It's not it's not like a huge amount, but I mean, it's 5 to 10%. I don't know what our calculations were, Terri, but I seem to recall about 5 to 10% extra in revenue based on what we had been doing through our previous cash plan. And that was that fully manual program. So it's not even that, like, yeah, if I had extra time to devote to figuring out what maybe a better, higher price would be, great. Well, the cash plan is doing that and also saving me time. So I'm gaining both in both aspects. I'm in the good on. So I would much rather have somebody manage that for me and trust that it's competitive, and we can. I mean, it passes the eye test, right? So if I'm billing 21 capsules of benzonatate for a Medicare patient because it's not covered on their through Medicare, because they don't pay for any cough suppressants through Medicare. If I'm billing that out and it comes back at a $50 price, I mean that's out of bounds. Nobody's going to pay that for that one-off prescription. But sure, if it comes back at around $20, which it's been pricing at pretty consistently around $20, yeah, I would say 8 out of 10 people are like, yeah, I'll take it. And all you've done is just flip it over to the cash plan, let it go. And it's taken 5 seconds of my time. That's much nicer. And it really, for us, it's also making sure that it's a benefit to the patient as well. I don't want to overprice stuff. I want to save them money whenever I can. That's part of how we've been in business for 60 years is we've gained the trust of the people in our community. And we don't want to lose that, but we also don't need to shoot ourselves in the foot when it comes to paying for the light bill and things like that. So this is really the best of both worlds. It prices that out appropriately with an additional 5 to 10% of revenue. So it's kind of pushing up against that whatever that arbitrary or invisible line is that we're trying to find of what the market will bear, but doesn't hurt them terribly as far as their pocketbook goes.
Yeah, and I would guess the vast majority of independent pharmacies, when it comes to their cash pricing, aren't overcharging their customers. They're generally charging far below market on most drugs because, they say, oh, just do cost plus 10% because that sounds like a number that works. And all of a sudden you're giving stuff away. You're not being competitive and fair to your own business.
Pharmacists, many of us, we're care providers, many times not businessmen. So we feel bad raising price on our patients, and they're due for years.
And you bring up a great point, and that's absolutely right. Most pharmacy owners were pharmacists first. So they got into the business because, generally speaking, most people who get into pharmacy care about people, and they want to help people, not to hurt them. So, and what I think PBMs have taken advantage of for so many years is that aspect of what pharmacy owners do. They're like, well, you're going to lose, Johnny, if you don't sign this contract, but that contract makes no sense for me to sign. Yeah, but think about Johnny, and if it's really hard for us to separate those two things, because if I help Johnny, but I lose the ability to pay for the electric bill and everything else, then I'm going to end up hurting Johnny too, and that's not a good place to be. So it is a delicate balance of making sure the business works, and also trying to take care of people in all aspects, financially and with their health. But we provide a much higher level of care than the box stores do. So I believe our time and our services are worth more than those other places are, and it's been reversed for so many years. Independents have typically sold their medications at a lower price, typically done all those things, been reimbursed at a lower price than CVS for obvious reasons, because they happen to own the PBM. But things are starting to shift. At least in our state, we've passed some really good laws that are protecting patients and pharmacies from these enormous companies that are not playing nice right now. So,
yeah. So as pharmacies are looking at that revenue stream outside the view of PBMs, Terri, have you been able to, really put that impact of using like the RedSail cash management plan and a case study, or really been able to demonstrate that value over, a short period of time in a pharmacy? And can you share some of that?
Sure. Well, we launched the program in the fall of last year, 2023. And what we saw was the average pharmacy participating in the program had a revenue uplift of around $1,700 a month. annualized 21,000 a year. So that's the average pharmacy in the program. And just my experience, the pharmacies in my territory, I've seen people all over the map. I've seen, like Joey said, some 5 to 10% opportunity. Others I've seen have quite a bit of opportunity, 20, 25%. And those are mainly the pharmacies which we just discussed. When I get in there and talk to them, they really haven't messed around with cash pricing in quite a while. And it was just something they haven't thought about or they haven't had time to manage. And, when we get in there, they see, a big uplift, big opportunity. And especially in some drug classes, when we start digging into the data, that they were really underpricing in their communities.
So I'm going to play devil's advocate and say I'm an independent pharmacist, and why should I, look for a solution that I have to pay for? I can price drugs myself. And we've already talked about a lot of the challenges and problems with that, coming up with your own pricing regimen. But, what does that cost look like? How is that passed to the pharmacy? And then after those costs are incurred, are the pharmacies seeing that benefit outside of that cost to the program?
I'll take that one first, and then, Joey can obviously speak to his own personal experience. But part of the impact review that we do with customers is look at that. Are you maintaining profit in the program? So we do, look at your price compared to previous year. We look at fees. But when we're evaluating your opportunity in the program, the first thing we do is look at, hey, does this make sense? Are you already okay at what you're pricing? Is there a variance to our algorithms that after fees is going to make sense? And the fees are normally a small portion of that overall revenue uplift that a pharmacy is going to experience. And like we've talked about, there are efficiencies there where you're getting the revenue uplift in cash. You don't have to worry about it. And then you can look for other areas of revenue opportunity while that is getting you, like Joey said, your 5 to 10%. Where else can I start building my business in the midst of all of this reimbursement chaos, right?
If you want to manage it yourself, it's going to take time away from you building your business in other places. Like we wouldn't have, whatever time it takes, that's time that now I can devote to getting this clinic up and running and being successful. So it's, do you think you're going to make money by managing a cash pricing program? That's the question you have to ask yourself as a business owner. And for me, it's that you can't even measure it though, right? Unless you have something to compare it to. So again, I don't know if you've ever had a situation where you've had a pharmacy sign up and they actually collect less revenue. Maybe you've had that, but my guess would be that over time, they will see an increase in revenue from gained business rather than it be a detriment, if that hypothetical situation even exists.
Yeah, and like I mentioned, we do our homework up front. The pharmacies that we would approach, we know there's opportunity there. And then ones that approach us, we do our due diligence. If we don't think this program's a good fit for your pharmacy, we're going to tell you, hey, you're doing a great job pricing in your market. Keep doing what you're doing. Unless you want to take that off your plate. We had one group, there are a little over 20 pharmacies. He was very close to our price, less than 5%. He said, I want to do this because I don't want to manage this pricing anymore. And I want my price to be standardized across my chain. I don't want anybody doing anything different. and they had a new pharmacy open up within their chain. He was not confident in the cash pricing that had been set up there. They were already on Pioneer. He turned the bin on himself and asked me for, permission later. He said, I hope you don't mind. I bought this new pharmacy and we wanted to get them on the program. What do I need to do to officially sign them up? Because this was just an easy solution for me to know that on day one, I'm confident in their cash pricing program.
Yeah. Yeah. And somebody else presented this to me, like, because, I grew up in a relatively rural area. I know how to change a tire. I know how to work on a car. And so, but somebody said, like, why are you working? Why are you doing the oil changes on your car? Like, because, I can do it and I like it. It's like, well, whatever time you're spending doing that, like, do you think that that's the most effective use of your time? And it just kind of changed my perspective on it a little bit. I still do some of that, but it's just because I want to do it now, not to save money or whatever it is, and I'm like, yeah, you know what? If I spent that, 30 minutes working on lining up things for the clinic, for instance, you probably would be much better off financially and otherwise focusing your attention there. So it's mainly for business owners. It's just about focus. You've got to focus on what your goals are. If your goal is to focus on a cash program, then that's fine. But I don't think that that's the focus for most business owners. And you get real caught up in, there's this nice little, have you ever seen the charts where you've got things that are important, things that are like have to happen right away. So you can have things that are not important and then that need to happen right away. Those end up just eating up so much of your time. And those things you just need to let somebody else do. Figure out who to delegate those things to and just let them do them. The things that are important and need to be done right away, those are the ones that you need to focus on as a business owner. And, the non-important, just the busy work that shows up throughout the day, like let that stuff go. Figure out a service or a person who can manage that for you, and you focus on what's going to grow your business and make you more effective in your business. So, and that's not managing a cash program.
Yeah. And, that's really what we talk about on this podcast is, what pharmacies are doing outside of dispensing that they're excited about. And I don't think anybody's excited about spending a lot of time reviewing their price tables. And I know on this podcast, we generally, don't have vendors or products. We've had a couple because they really are part of the success story of a pharmacy. And I love when we can share that. So with that, we're about out of time. But Terri, if somebody does want to learn some more about this program and maybe see, some of the statistics and information that you can share that, can show really how this can, change the cash flow of their pharmacy, what should that pharmacy do?
If you go to the RedSail Advantage site, there's a link to the cash program. You can learn about it, as well as there's a link on there to actually schedule a demo with one of the clinical consultants. So you can learn more about the program and, like I talked about, to see if it's a good fit for your pharmacy, and to learn more about those customizable pricing options and things like that are just recently launched based on some feedback from early participants like Joey and Cheek and Scott.
Yeah. And so if you're a Pioneer RX user, you have there's a RedSail logo where you can access that dashboard to get more information from that software. So is this program limited to Pioneer RX customers, or Who can take advantage of this?
Yeah, right now, Pioneer RX, and then we will be rolling out to the IQ base very soon. So be on alert. It may even be by the time this podcast is aired, but we will be rolling out to the IQ base this year, in the first half of the year. So
awesome. Well, guys, thanks so much for joining. I can't wait to hear more about what's coming from the RedSail Advantage. You guys definitely check that out. Being under that umbrella does kind of give a unique opportunity for independent pharmacies to work together. And I really hope independent pharmacies are, open and really embracing that opportunity, because we see opportunities in those groups of independent pharmacies working together historically so well. So thanks so much for everything you guys are doing on that front. Joey, I can't wait to hear what you guys are up to down in Florida next time I run into you on the road this summer, probably.
Oh, yeah. We're moving and shaking as much as we can. And I will say the setup for the program was unbelievably easy. Just getting it onboarded, it takes less than a day. And like I said, you can focus on other things like, I was able to help start a free clinic here in this, in our little town. So like getting back your time is a big deal, and you can take that time and do lots of really good things in the community that you serve. It can be running your business and making that really effective, but it can also be whatever you want it to be. And yeah, I would rather focus on how we can transform healthcare within our little community, and we're helping to do that largely because of services like yours. So
love to hear what you're doing down there, Joey. And I think the key point to all this is, hey, we have technology. Let's leverage that to free us up to provide those clinical services that AI cannot replace, right?
Yeah. Maybe sometimes that benefit is as simple as going to lunch and not worrying about your cash pricing being consistent.
Bingo. It adds up. I'm telling you, it adds up. You think you're not spending a lot of time on it, but you are.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow Pioneer RX on your preferred social media platform.